Hey everyone, Haley Arnold here. Today we're going to be doing our maternal checkoff 3. What we're going to be doing is immediate care of the newborn right as soon as baby is birthed. We're going to be doing a couple of extra things as well as far as breastfeeding and bottle feeding. We're going to get into that a little bit. We're going to get into baby's first bath, and then we're going to include a couple extra teachings at the end to make sure that mom and dad are going home confident in being parents. So firstly, what I'm going to do is I'm just going to do a quick sweep of the room. Alrighty, and next I'm just going to show you where I'm going to be standing real quick. I don't have any extra resources. I'm doing everything by memory. And I'm just going to tell you right now, we're going to be using our imagination today with some of our supplies. I have a fake baby with her umbilical cord that is still clamped. We've got a couple washcloths for whenever we give baby a bath, swaddle blanket, some caps, bulb syringe, diaper, a fake breast to demonstrate hand expression, which we'll get into later. We've got armbands for baby. We've got our Hep B vaccination, erythromycin eye drops, and we've got our nipple. Alrighty, let's get started. Okay, so we're just going to go from the top. So, mom's in the birthing process right now. Doctor's telling mom to push, 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 and we have baby. And we're just going to go ahead and quickly take our blanket, and we're just going to start rubbing baby, getting some blood flow going. And we're listening for a cry. We have no cry yet, no cry. There it is. We have a nice strong cry, which is exactly what we were looking for. First, we want to aspirate baby. Now this is our bulb syringe, and I really want to stress that before you put this inside your baby, you need to get all the air out first. And we're going to start by going in the corners of each mouth. And we're going to aspirate. And we're going to go inside each nair. Alright. Next, I'm just quickly looking at the umbilical cord. There does not seem to be any signs of bleeding. There is 2 veins and 1 artery, which is what we want to see. And I can feel a pulse in the umbilical cord, and we'll get more on that a little bit later. So, baby is going to need to be thermoregulated. And we need to make sure that after baby's dry, we have baby in a cap and a blanket. And we're going to put baby on mom's chest for that golden hour for skin-to-skin contact. This is great for bonding for the baby. It helps to thermoregulate the baby, and it gets baby familiar with being outside of the womb on mom on the first time. So, while baby is on mom, I'm actually going to perform my first APGAR score. Now, the APGAR needs to be done within the first minute and then at the next 5-minute mark. So I'm just going to do a quick run through with the APGAR score real quick. Again, baby would still be on mom. We're definitely using our imagination here today, and we're just going to kind of go with the flow and kind of make up our own scenario as we go. So let's say whenever baby came out, the baby's extremities were blue. This is called acrocyanosis. Acrocyanosis is totally normal and it's okay, and we will reassure mom and dad that this would go away within 24 to 48 hours. So we have acrocyanosis, which gives us a 1 for our first A in APGAR. Next, we're going to assess the pulse. You can take the umbilical cord, and I do want to say that I definitely have gloves on at this point. I just don't have any on me right now, but we would definitely have gloves on to protect you and the baby. So you can actually take the umbilical cord in your hand and you can feel a pulse. And whenever we're doing our pulse, we want to count for 6 seconds. We want to count how many beats we feel in those 6 seconds. So let's say, for example, we had 11 beats that we felt. We're going to multiply that by 10 to be equivalent to 1 minute. So our baby has a pulse of 110. Anything over 100 is going to give us a score of 2 for the P on our APGAR. So we've got a strong 2. Next is going to be G for grimace. So whenever we were stimulating the baby, was the baby making any facial expressions? Was the baby not making anything at all? So let's say whenever our baby came out, we said that she was crying a lot and very loud, and making some faces while we were stimulating her. So that's going to give us a score of 2. Next is the second A is going to stand for activity. So while we were stimulating the baby, was the baby's extremities flexing? Was there no movement at all? So we'll say that she had some flexion, which would give us a 1 for the second A. And lastly, the R stands for respirations. So babies, whenever they first start breathing, they don't breathe with their diaphragm. They breathe with their stomach. And the stomach and the chest should rise and fall at the same exact time. And we already said that our baby had a very strong cry. So we'll say that the score for the R would be a 2. So let's go through real quick and let's add up our score. So we had 1 for acrocyanosis. For the pulse, we had a score of 2 because the heart rate was over 100 beats per minute. For the G, we had some grimace, a little bit of grimacing. Actually, no. We said that baby was crying a lot. So that's going to give us a 2 for G. Next is going to be activity. We said that the baby had some flexion, so we're going to give baby a 1. And then for the last category, for R, respirations, again, baby had a very strong cry, which means that they're getting oxygen inside their lungs to be able to force out that cry. So we're going to give a score of 2 for that category. So in total, we have an APGAR score of 8, which is awesome. We want anywhere between 7 to 10, and that indicates normalcy. So we've got our first APGAR score. Next, we're going to check mom and baby's bands. So we need to double check and make sure that the bands have the same exact numbers on them. So we've got mom's information. On the babies, I believe we have mom and dad's information, and we need to just double check and make sure that these bands have the same exact numbers on them, and they do. So we have 1, 2, 3, 4 and 1, 2, 3, 4. We're good on that. We're awesome. Next, we need to instill our erythromycin eye drops. This is just kind of a prophylactic measure. What we're going to do is we're going to take a washcloth or a baby wipe and making sure that the baby is swaddled so that way we don't have any arms flailing or anything. What we're going to do is we're going to clean the baby's eyes real quick. And we're going to go from the inner eye, the inner canthus, to the outer. So inner to outer. And definitely want to stress that every time that you wipe the baby, you want to use a different position on the washcloth. So from inner to outer, and we're clean. We're going to take our eye drops and we're just going to gently hold open baby's eye. We definitely need to make sure that we do not touch the tip of the eye drops to the baby. So we just want to pull down the conjunctiva a little bit, make sure it's exposed, and then drop, drop. And we will close baby's eye and massage it ever so gently to make sure we get good distribution of the eye drops. And then we'll repeat on the other side, drop, drop. And we want to tell mom and dad to not wipe away the excess for 1 hour. We want to make sure that all of the medication is being distributed. And then next, we're going to have a Hep B vaccination. So with babies, you want to use the vastus lateralis muscle, which is going to be on their leg. And we're going to have to do 2 of these for the Hep B. So I have cleaned my site and everything. I have the correct medications and whatnot. All of my medication administration steps have been done. We're just going to pinch and boop, all done. And clean the site, pinch and boop, all done. And of course, baby's probably going to be fussy and not like that at all, but that's okay. And that is it as far as it goes for immediate care as soon as baby comes out. We want to make sure that we report any pertinent and important information to the healthcare provider or to the charge nurse. Next, we're going to move on to baby's first bath. Now for this, I would have the parents come over And I would try my best to not actually wash the baby myself. I would walk mom and dad on how to do it, so that way whenever they get home, they're not completely freaked out because everyone else was doing it for them in the hospital. They actually have some idea of what's going on. So I got my water running. I have several washcloths here for the baby. I've got some shampoo and I've got a little brush for baby. So I've got my water running right here, and I've got several towels on a surface because we do not want the baby to get hypothermia or heat loss by conduction, which is where they're on the surface, just the straight surface, direct contact with the surface, because surfaces are cold, you know? So, okay, for the holding of the baby, we're going to do a football hold. It's going to be just like this. And we've got our water running. I'm going to take baby's cap off. We're still swaddled. I'm going to run baby's head underneath the water to get it wet. A shampoo, boop, boop, boop. And then we're going to take our brush and we're just going to go in circular motion, very gentle. And this will help prevent us from getting cradle cap. All right, then we're just going to run baby's head underneath, lay baby down. And we're just going to pat dry as we go. All right. Now, I do want to hit on something very important. When you have baby on a surface like this, you do not want to turn your back away from baby. You want to make sure you have a hand on baby or right above baby, so that way, in case they flail or they turn, they don't fall off the tall cabinet or what have you that the baby is sitting on. So I've got my several washcloths. I'm going to take my washcloth, run it under the water, and I'm just going to start from head and go down to the toes. So again, I'm going to clean the baby's eyes from inner to outer canthus. Every time I'm rotating my position on the washcloth. I'm going to clean baby's face, keeping them swaddled the whole time, making sure I'm getting their ears. And then I'm going to go down to the neck, getting in between any crevices. Alright, I'm going to be done with this washcloth. Next, I'm just going to expose baby's trunk. And we're going to say our baby's umbilical cord is definitely clamped at this moment. So we got our clamp. I have my other washcloth and run it under the water. And I'm going to get in between any crevices, make sure I'm getting the trunk of the baby. Again, patting dry as we go. I'm going to get the arms all the way down to the fingers, getting in between every crevice, making sure we don't have any more of that vernix left over. And then I'm going to make sure that the umbilical cord stays dry. I'm going to clean the umbilical cord, clean around it, and then immediately pat dry. And then I'm going to make sure that the top half is covered while I move down to the bottom half. I'm going to clean the perineum first, getting in between the hip and leg crevices. Different position on the rag every single time. Clean down the legs in between the toes. Alright, I'm going to get rid of that rag because I'm sure, you know, if you clean yourself in the shower, you don't want to clean your private parts and then start cleaning the rest of your body on the same rag. Then we're going to flip over baby. We're just going to do the back real quick, making sure to get any inside of any extra crevices that I think I may have missed. Right down the butt crack. We're going to put that away. We're going to make sure baby is nice and dry. Got a diaper for baby. Alright, we're going to get baby all nice and swaddled back up. Getting our cap on. And voila, you have just done baby's first bath. Okay. Next, we are going to move on to breast and bottle feeding. The very first feeding is very important. So first what I'm going to do is I'm just going to demonstrate with my fake breasts here how to hand express. There may be instances where baby cannot be in mom's room and baby cannot feed from mom and her colostrum directly. She may have to go to the NICU, and we would want to express the colostrum inside a bottle for baby to drink in the NICU or eat, my apologies. So for hand expression, what we're going to do is we're going to massage first. And we're just going to take our knuckles and go from the back of the breast to the front. Or we could just do nice long strokes. And then we're going to make a C with our hand. And we're going to go around the breast. And we're just going to start applying pressure and squeezing. And there should be little droplets of milk that start to come out the nipple. That's exactly what we want. That's the colostrum. So I'm going to ask mom. First, I'm going to show her a couple of different moves that she could do with the baby as far as holding. Of course, we've said before we have the football hold that we could do. Or we've got the classic cradle that we can do. So let's say mom wants to do the football hold with her breast. We want to make sure that baby's head is above the stomach. We don't want the baby to lie flat. We want the baby at about a 45-degree angle for good feeding. And we will make sure that baby is coming to mom and coming to mom's breast. We don't want mom always bending over and trying to bring her to the baby. We want baby to come to mom. So for demonstration purposes, I'll just kind of show. We'll take mom's breast and mom will put the nipple on the baby's lips, and she can express a little bit of milk at this time. And there is a suckling reflex that the baby will have. So the baby, will start to look for the nipple and suckle. What we want to do is we want to get the nipple as far back in the baby's mouth as possible. This will ensure a good latch. Now, when we have the baby latched, we want to make sure that we're listening for any smacking sounds. If we hear some smacking or some very loud suckling, that means that the baby probably doesn't have a good latch. So what we want to do is just kind of reposition and make sure that nipple is definitely back there inside the baby's mouth. And the baby's feeding. Let's say baby's done and it's going to be about time to burp. And actually, with breastfeeding, if you get a good latch and a good suckle, you may not even have to burp. So let's say mom's done feeding. To ensure a proper unlatch, I guess you could say, mom's going to take her finger and she's going to kind of almost fish hook it at the side of baby's mouth. And of course, we're not going to be too forceful with it. And she's just going to take baby's mouth and slowly back away with the breast, and this would ensure a proper unlatch. And then as far as afterwards, we want to make sure, of course, the baby's head is still above her stomach, and she's at an angle. We don't want to lay baby flat right after eating. There's a possibility for aspiration, and we don't want to do that. Now for bottle feeding, slightly different, but for the most part, same concepts. So say baby's in a cradle position. We've got our bottle with our milk. And one thing that you want to ensure is the bottle is upside down and there is milk that can be seen in the nipple. We want to make sure that the nipple is always full of milk because we don't want any extra air to get inside baby. That would be very uncomfortable and could cause gas, and that's why we need to burp the baby. Another thing that I really want to stress upon is whenever you're feeding the baby, you want to make sure you're holding the bottle and you're not using another blanket or something to be holding the bottle for you. You want to be in control of the bottle and you want to bring the nipple of the bottle to the baby. Now, whenever we're having the baby latch onto the nipple bottle, the bottle nipple, we want to make sure that whenever it goes in, again, we have full milk inside the nipple, and then that the nipple is above the tongue. We don't want the nipple to go underneath the tongue, on top of the tongue, so that way we can get a good suckle. And again, we're listening for those same sounds. You know, we don't want any like forceful smacking of the lips or anything, because again, this indicates a bad latch. So you want to feed for about a ½ ounce to an ounce. So we're going to check, and it looks like the baby has drank or eaten about a full ounce. So next we'll take baby, and again, you want the baby to be head above the stomach, and you want the baby to be upright after feeding for about 30 to 45 minutes. And this goes for both breast and bottle feeding. And we'll just, you know, do a little pat and make sure we get some burps. And of course, the same thing still applies with laying baby flat on their back afterwards. You do not want baby to aspirate. Alrighty, and that is that for our breast and bottle feeding. Lastly, I just want to hit upon a couple of things as far as some teachings go. I definitely first want to hit on car seat safety. Many hospitals will not allow you to leave the facility unless you have a car seat already. We want to make sure that that car seat is a 5-point harness, making sure that the belts go over the shoulders, in between the hips and the crotch, and I suppose you could almost call it a 6-point, counting the breast clip. Now with the breast clip, I definitely want to stress and reiterate that it needs to be at nipple line. It cannot fall below that and be on the stomach. It can't be right up here on the neck. It needs to be right at the nipple line. It is cold this time around, so let's say, for example, you and baby are gonna go to the grocery store on a day as cold as this. Babies only need 1 extra layer of clothing than we do. Their body temperature should remain between 97.7 to 99.4 degrees. And you can always take your baby's temperature at home underneath the armpit or the axillary. You're going out on a day and you have a onesie on, another jumper on, and then you have a big puffy coat for your baby. You don't want to put the baby in the car seat with that big puffy coat, because this can loosen the harness and the baby won't be technically strapped in the seat very well. So if you do go out, you can just have that onesie, the jumper, and then you can throw another thin blanket over top of them. You want to make sure that that car seat is rear facing. You don't want the baby to be facing where they can look outside the windshield just yet. That's not for another couple years or so. Another thing I definitely want to hit on is sleeping. So co-sleeping it's not really a good idea when the babies are so small. Number one, you know, baby can roll out somewhere, roll off of the bed. Mom or dad could roll onto the baby. The baby definitely wants to be in their own crib. They need to be in their own crib. And they need to have a firm mattress. You don't want anything too soft where the baby's sinking into it. Another thing regarding the crib, you just want the baby swaddled in that one blanket. You do not want any extra blankets or pillows or stuffed animals or anything like that, because the baby could suffocate if they have too much going on inside that crib. SIDS is very serious, and the risk of SIDS does increase with co-sleeping and whatnot. So we definitely want to make sure that baby is in safe hands as far as sleeping before they go. We want to make sure our parents are very aware of the dangers of what could go wrong. It's not necessarily to scare parents, but it is a crude reality that really makes you think. And you just safety is the number one thing. Safety is number one. I believe that covers it for today. We went over a lot, you guys. Thanks for tuning in, and we'll see y'all later. Bye.